With the first commercial flight in 7 months expected to arrive on October 12 at the Cheddi Jagan International Airport, the Ministry of Health has implemented protocols that must be followed in relation to testing passengers for COVID-19 on arrival. The current protocol in place outlines that persons entering Guyana are required to present a negative COVID-19 polymerase chain reaction PCR test result. However, this test must be taken within 7 days of leaving their countries of origin. Providing additional insight to this newscast and how the upgraded testing modality will be employed once the airports reopen, Director General of the Guyana Civil Aviation Authority, Egbert Field, explained on Friday that if the COVID-19 test report of arriving passengers indicates a 72-hour hiatus between the time the test was conducted and the boarding of the flight, such passengers will be allowed free entry into the country without any self-isolation requirement. He noted, however, that if the report outlines that the test was conducted between 4 to 7 days prior, those passengers will be tested on the ground.
If the report states that the test was between 4 to 7 days before the flight, then that passenger on arrival at Temika will have to do test on arrival. They will have to await the test report at Temika. That should be about maybe 4 hours of waiting at Temika before they're allowed to depart for their homes or hotel.
Additionally, passengers who are tested positive on arrival will be immediately quarantined by the Ministry of Health.
If the test is negative, then they will be able to proceed to their homes and allowed to roam freely without any quarantine.
Meanwhile, newly appointed Chief Medical Officer Dr. Narain Singh, during an exclusive interview with Nightly News on Friday, disclosed that the passengers who test positive upon arrival into the country will be given the option to isolate at a government facility or at their homes, depending on their case definition. During the 7-month closure of the airports, which mainly allowed entry for repatriated Guyanese, arriving passengers were required to complete a mandatory 7-day quarantine at their homes, even after presenting a negative COVID-19 test results to port health officers. The Ministry of Health's surveillance team conducted various checks with those persons by way of phone calls to ensure that they were complying with the stay-at-home order during the stipulated time. When asked by this newscast why the mandatory 7-day quarantine is no longer a requirement for the passengers that are expected to arrive in the country from Monday, Dr. Singh pointed out that effectively monitoring hundreds of passengers will pose a challenge for the ministry.
To monitor everybody that comes in, it is going to be a tremendous task on the surveillance team to really contact everybody that comes in. So that's why the cutoff thing is 3 days, and those patients can go. The 4 to 7 days period, we'll have to do the test there, and then they can go. So you could put less strain on the system to monitor these patients. These passengers.
Meanwhile, on Friday, opposition APNU AFC Member of Parliament Correia MacDonald dubbed the reopening of the airports as an irresponsible move by the government, considering the steep rise in new infections and deaths.
In a few days, our international airports will be reopened, and we can expect that from this irresponsible move, will lead to even more increased cases in Guyana, and where our health system is already under immense stress.
As of October 8, confirmed coronavirus cases had surpassed 3,300 and deaths had reached 100. There has been a total of 18 deaths for the month of October, which is only in its 8th day. Temika Rodney reporting for the HTB Nightly News.